This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHD-HD, WOGL-HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to the show. If you feel warmth coming from your radio, we're sending extra amount of warmth out there today because if you get out there, whew, it's cold. Nice to have you with us as always as we discuss for the next hour a lot of information provided by Dr. Molly Fantasia about you and your family and the overall health picture. That's what we do here on the show. We discuss what Innovative Medical Associates does and how they do it and why they do it. We'll do all of those things right here on the program. Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia, as we said, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. And the number here in the studio, if you have a question for Dr. Molly, 855-839-1210, 855-839-1210. Yeah, we'll try to put warmth out there this morning. Dr. Molly.
A lot of love. I got to send a lot of love to all my patients.
Right. Innovative Medical, and you had a really busy week.
Oh,
which it
very
seems like
busy.
they're getting more busy.
Well, I think people are finally getting the idea that if you don't worry about your own quality of life, nobody else is going to worry for you. Doesn't matter what kind of docs, what fancy, associations you go to in terms of the systems and whatever. You can go to the biggest place in the world and still not feel quite right.
And you've had probably hundreds of patients that kind of make that description.
Oh my gosh!
I've been to this one, that one, this one,
yeah.
And I just don't feel right.
Right,
Yeah.
and then I tell them, well, look, we're a primary care facility. Everyone who works with us works out of the primary care facility, and our healthcare providers understand this, and we know that the use of nutritional medicine, meaning natural substances, can augment your pharmaceuticals and maintain your quality of life, and maybe, just maybe, reduce your need for pharmaceuticals or reduce the dosing for pharmaceuticals, which then doesn't allow you to have what? The side effects.
The side effects, which we've talked extensively about side effects.
Yeah. So here we are. We can do anything that any other primary care. I like to liken it back to the old days of like Dr. Welby. He had a black bag, and we have a black bag too.
Right.
Only in our black bag there are things like vitamins, minerals, and amino acids, and we use hydration as the vehicle for those, so that people can get an appropriate dose at a therapeutic level to augment whatever kind of challenge they're having and hopefully improve their quality of life.
Every patient asks this question in the initial consultation.
Oh, yes.
Dr. Molly, I have 3 health food stores in my neighborhood.
Yes.
And I can go there and get everything that you give us in a hydration bag.
Yes.
So doesn't that do the same thing?
The answer is no. It can't do the same thing, because no matter what the quality of the nutraceutical is, and believe you me when I tell you we know good quality nutraceuticals, we can help you go to that health food store and augment what we do as well. But you lose so much in the digestive tract that it takes quite a bit of nutraceutical orally to really deliver what we do through the hydration. And you know what? It seems like the hydration gets you to feeling better quicker.
Well, because the dosing is
appropriate.
It's like 100 times what you'd get in a health food store, right?
It's like, it's funny. I had a patient this week. She came in from another well-known doctor, and she calls me before she started. She had booked the appointment to start. She has cancer. And she goes, I didn't tell you about Dr. So-and-so, but this is what I got there. And I said, yeah, and I'm listening to the dose of vitamin C she was getting. I said, honey, that's our half dose. That's the dose you get half before we get back your BUN and creatinine and your 6-GP, which you do on the first dose, just to see how well you take the fluids. She went, oh, what can I say? It's the truth. So really what she was getting all along in her IV for her cancer supportive care was half of what we put in ours.
And that brings up a question, which I've always asked you this. how would someone like that know, unless, of course, she met you? How would she know that she's getting half a dose over there, but you're giving a full dose, and you're giving a better quality?
I'm giving her a better quality dose and a dose that's more appropriate for where she is in her cancer continuum. In other words, what they did was they used a traditional recipe. They didn't customize the recipe for the patient, okay? And because it looks the same all through the clinic. Here's the other thing I get. Okay, I'm glad you started me on this. Oh, the first bags all look alike. Hello, that just means that there are certain similar or like nutraceuticals in there. But you'll notice in our clinic, they're getting 2, 3, 4 bags after that, right?
Yes.
A whole lot of appropriate changes are done in those bags as well as in the first bag. Stop looking at colors, guys. It means nothing.
Yeah, it's not like the food coloring you use when
That's
you're baking.
right.
It's not that like same thing.
No. So you're right. So how would she have known if she didn't talk? So one of the things is look, let me tell you something about Dr. Molly. I have no ego in this. My job is to do one thing because I believe that my Savior is the great physician. Okay? Not me, the great physician. So wherever you went is okay with me. I can only tell you what we do and how we do it.
And that's pretty much it. But
Right.
but you understand the question that people listening to this show, well, they hear us talk every week about what you do,
Sure.
so they have a little better understanding. But someone just walks in off the street to any facility,
Right.
They're not really aware of the differences,
Right.
and the nuances that you provide.
Of course. In fact, I had a physician come in and say to me, "Oh, you buy your product from such," and I said, "No, I don't. That's all manufactured." "Oh my God," she said. "No one," she said, "that's pretty expensive what you do." I said, "It is, but it's worth it."
Yeah. Well, everybody's an expert. Did you notice that?
Oh yeah, I love it.
So, innovative medical, the cornerstone is the hydration.
Correct.
And in the hydration is customized nutraceuticals
right.
based on the person's condition.
Right, and where we are. In other words, where are you in your continuum? What is it that you want to effectuate the change in? And you'll notice I come on the floor every day, okay? And I talk
Several
to my
times.
Yes, and I talk to my patients because I want to know what is it that they want to accomplish. That's the point. In other words, it doesn't matter what I want to accomplish. It's what you want to accomplish. Do you want more stamina? Do you just want to be healthy enough to maintain chemotherapeutics or to maintain radiation? I mean, I treat a lot of cancer supportive care. And I can tell you that they tend to do well. As I say, John, people who do all conventional, I know them, they're not with me. People who do nothing but quote-unquote alternative medicine, they're not with me. People who do both, they tend to be in balance, and they live the longest.
Well, that's why I'm doing both. I mean, we've talked about my back
Amen.
problem, and
Right,
this
right.
week you sent me to a pain specialist.
That's right.
And
That's
you
right.
said he'll help you. But
and
in
come on
addition
back.
to what you're doing.
Absolutely.
But it's interesting because, you know, as I said before, everybody's an expert.
Of course.
You know?
And you must hear it out there because you're out there for a long
twice
time.
a week. Yeah,
right.
I
you're
mean,
out
and
there.
I hear it, you know.
Yeah, I get the reports back from my gals, but you know, I don't know.
But you do visit, so people understand. You come out on the floor
Sure.
several times, and
Right.
you talk to each patient. How you
That's
feeling?
right. How you
feeling.
doing? What's
Yeah,
going
You
on?
know what's going on. But a lot of time, you said this earlier, and you've been very busy lately, and that's a good thing because you're
sure.
helping people. But
Sure.
you said people wait till they're at the desperate stage.
Right. Desperation
And-
medicine.
And perhaps if they come in earlier, they have a better chance. Isn't that
They
true?
would do better. Of course, the earlier you jump on, look, it's like everything. The earlier you get involved in your situation, the better off you are. Doesn't matter what situation,
Right.
but in particular, a medical situation.
And how many people come to you and say, "Well, Dr. Molly," you say, "Well, how long you felt like this?" "Oh, 2 years."
Yeah,
You know.
yeah.
And-
When was the last time you had the colonoscopy? 5 years ago, and they found cancer. Well, now you're coming to me.
Yeah,
you know?
exactly.
Why didn't you come to me right after they removed the polyps or the precancer or whatever?
How can you get people to understand that early is better and actually really encourage them to take action earlier?
I think you can just keep saying it. Listen, the traditionalists tell you that early's better. So early testing is better. You got to do things to maintain your health. Look, we are still, no matter what, we are a functional primary care facility. And in doing that, we're all about your health and wellness. And I mean wellness through every continuum, whether you have a chronic condition like autoimmune, whether you have a cancer problem, whether you have a PSA that's elevated and it's non-cancerous, right? Anything that impedes your ability to enjoy your life, I want to know about. And you should jump on straightening that out, because you know what? We get one body in this lifetime.
Right, yeah. This isn't a dress rehearsal, as somebody always says.
No. We got to do it.
Right.
We got to do it.
We are coming up on our first break of the morning. Our show is Health Watch, and you'll find us here every Sunday from 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. If you have a question for Dr. Molly, you have a medical challenge, this is the time to call in, 855-839-1210, 855-839-1210. We always tell you, call in early. Like if you call in now, we have plenty of time to talk to you, and there's a good chance that you won't get shut out, which happens all too often, and we don't like to do that. 855-839-1210 is our number. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return more of today's Health Watch after these words. Back here on Health Watch, and as per usual, while we're on here on the program, operators are standing by at Innovative Medical. So if you're a little bashful and you say, well, I don't want to come on the radio and ask a question, well, you can call the operators right now. 856-489-0505, 856-489-0505. That's the number. Innovative Medical Associates, Marlton, New Jersey. And when you call, ask the questions, and if you want to make an appointment with Dr. Molly, that's the best thing you can do. And, of course, the initial consultation is complimentary, and you can really learn a lot, not only about what Dr. Molly does, but about how it can relate to your particular situation. So it's pretty easy. Call the number, 856-489-0505. And you can check us out on the web, innovativemedicalassociates.com, innovativemedicalassociates.com. That is the website. And, of course, our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. The number here in the studio, if you have a question for Dr. Molly right now, 855-839-1210, 855-839-1210. You know, Dr. Molly, we've talked often about a lot of your patients, and they tend to be mature.
Well, sometimes. But I have a fair amount of young ones,
But we're
too.
going to talk about college athletes.
Exactly.
And in particular, the situation where they go back to school and all of a sudden
they got COVID.
Yes.
Now,
so talk about what
this
you've
is
done.
pretty interesting. You know, how do you adapt your college student to the COVID upheaval? How do you do that? Well, anyway, several of my college athletes went back down south, and as luck would have it, they tested positive for COVID-19. All right. So actually, the mothers are very intelligent, and one of the mothers is an extremely good patient of mine for many years. She is a cancer survivor and very astute about nutrition. Anyway, she was lucky enough to spring her son, even though they didn't want to let him go. And apparently, parents still have rights in this country.
Isn't that nice to know?
Isn't that good? So she brought him back home and brought him directly to me. And it's very interesting because college athletes, or athletes in general, not just college athletes, but younger athletes in general, really pose certain challenges that I need to meet. So, of course, you've heard me time and time again to really keep your immune system up. Now, if a college athlete tests or a younger person tests positive for the corona, I still believe we have to tweak their immune system. So again, I'm going to go through some of the things that I go through with regular folks, which is the vitamin D, the zinc, the beta-glucan, the NAC, and quercetin, among other things in their IVs. But I have to really go beyond that because we need to really maintain their muscle integrity, right? So in that case, what I did for this past 2 weeks, by the way, I isolate these kids. They don't come at the same time other people come. They're in their own private rooms. Then their private rooms get a room scrubber, get sprayed down, do everything. But I really feel as a healthcare facility and provider, we have an obligation to treat people who may test positive. And by the way, the young people didn't seem to have the same symptoms that older folks have. They didn't quite have the respiratory problem. But of course, what did we want to do? Dr. Mark and I wanted to make sure they don't get the respiratory problem. So of course, we treated with an antibiotic prophylactically. But they sat through 6 days of IV therapy, intravenous therapies. So we increased their hydration, which helped. We used nice dosing of vitamin C, and we put other things in there, including things that will maintain their muscle mass, right? Because they're not working out like they were. We also wanted to really stress upon them that, yes, they've got to go home and rest, but they should do the stretching exercises, the yoga, if they can. So actually, in 3 days of the hydration, they felt much better. Those that lost their taste and smell came back by the 5th day. Okay, that's pretty cool.
It is.
It's
really
pretty cool. And none of them had fever. So we used plant-based proteins for them. We used things like amino acids, including choline, to help maintain normal muscle function. So we also used a set of anti-inflammatories. And of course, high vitamin C, your friend. So this really helped improve their overall health and actually helped reset their own immune system. So by the end of the 7th day, they were in good shape and started to test negative in our clinic. And I said, look, you're supposed to quarantine for the 14 days, yada, yada. And they are. But the point is, they're testing negative already. At the 14th day, when they went back to school, they were negative and ready to rock and roll in their gym.
I have to ask you, does the fact that they're younger
Oh, yeah.
contribute to the quick recovery?
Of course,
Okay.
of course. But I'm faced with a set of challenges, too.
Yeah.
Because we don't want them in 7 to 10 days. Don't you think you could lose some muscle function?
Absolutely.
Really? Yeah. That's what we're talking about, even for the older folks. So, of course, I have to look at the muscle integrity and make sure they can maintain that, and also make sure their reserve is there so that when they go back to work out, they can get right into the college program.
Which brings me to this question.
Okay.
You've talked about this before, but I'm thinking, listening to you talk about athletes, can people come in and get, because I feel like what I get helps prevent COVID for me.
Well, for you.
Yeah.
Okay, but I can't say I prevent COVID.
No, I know you can't say that, but should people consider some kind of treatment that you provide?
I would. I absolutely would, because I think the hydration in and of itself, the flushing out in and of itself, I think helps a lot. Certainly, if you have a chronic condition, we need to look at that. We might want to up the trace minerals, but there's a fine balance, John. You know, don't I wish I could do it all, make it holy water and do everything for you?
Absolutely, I know.
I can't do that. It might mean that someone might have to come in an extra time a week for us just to address the prevention of COVID. But I'll tell you, most of our patients just coming in the way they do tend to do better with these chronic conditions. One of the things that's worrying me to death is that people are running around to get these inoculations, the vaccines. And I heard something on the news that really disturbed me. The person said, now I can go out and I'm fine. I don't know. That may not be true. You better still wear your mask. You better do all the things they taught you in kindergarten. And you better continue to be careful about where you go and around how many people.
Well, yeah,
Right.
that's what they're saying. They're telling everybody that.
Well,
Do all
I
that.
heard a TV reporter spoke to someone who had this done in Philly, and they said, oh, this makes me feel like I can go back to church at full. No. You still have to be very careful, and I urge people to take those warnings seriously. And again, do what we taught in kindergarten. Wash your hands. Don't sneeze on anybody. Please don't spit on the ground. I mean, all the things that you should normally do. So anyway, that's the story of my college athletes.
But the point is, taking that
Yes.
It
Help them recover quicker.
Exactly. So that's a good barometer of
And
that.
actually, the young man that I'm thinking about called me and said, I want to tell you something, Dr. Mall. I said, what? He said, guess what? I did a strength measurement. He said, I didn't lose any muscle strength through this thing. I said, well, thank you so much for the call. And he goes, I think it's the amino acid mixture. I said, I would think that's true.
So it just goes to show you that like you said, you can't say you prevent COVID. Which nobody can say that.
But I think what I can do is say clearly that our tweaking the athletic protocol that we have, and we do have one, an athletic protocol IV. The idea was tweaking that a little bit, I think, aided them in their recovery and also aided them so that their recovery in terms of their muscle situation, muscle functioning, wasn't severely debilitated.
But you tailored that protocol to athletes.
That's right.
But my point has been that you can tailor to anyone.
Right,
in terms of COVID prevention. Right. Doing the best you can to prevent
let's
it.
put it to you this way. Yes, we know that the hydration with the vitamin D, all the things that talk about the beta-glucan, NAC, quercetin, and the B vitamins can help prevent or help you maintain your immune system to help prevent COVID. I want to say it that way. In this case, these young people tested positive for COVID, and what I was trying to do was maintain their muscle integrity.
All right, we're coming up on a break. We're at the halfway point of the show. It's Health Watch, Sundays 8 till 9, here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. Good time for you to jump in here with a question or a medical challenge you want to run by Dr. Molly, whether it be about pre-COVID or anything else. 855-839-1210 is the number. 855-839-1210. It's Health Watch, Sundays, again, 8 till 9 here on Talk Radio 1210, WPHT. With Dr. Molly Fantasia, I'm your host, John DeMasi. We're coming back. More of today's Health Watch after these words. Back here on Health Watch, as always, operators standing by at Innovative Medical Associates. And the number, 856-489-0505. 856-489-0505. It is Innovative Medical Associates, Marlton, New Jersey. When you call, you may have some questions, and feel free to ask them, and they'll do their best to answer. And if you want to make an appointment with Dr. Molly, that's really the best thing you can do. Just make that appointment, the initial consultation complimentary, and all you have to do is call and make it, 856-489-0505. And, of course, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good information on the website, which can kind of help you along to understand a little better what's going on at Innovative Medical. You want to talk to Dr. Molly right now here on Health Watch, 855-839-1210 is our number in the studio, 855-839-1210. You rarely talk about this on the show, but I know you wanted to mention your corporate clients.
I really want to send a shout out to a group of young guys we really have who come into our facility at least once a week, and we're doing some corporate work with them. And I will tell you, these guys all got together and they saw a patient who came in because, again, the floor is large. They are in a private room. And they said, oh, we know that young lady. And actually, she's not so young. I would say she's seasoned, as Barbara likes to put it. Anyway, they all got together and they decided to have the corporation pay for her next set of treatments because her husband worked for their father and them, and they said he was one great guy. So I want people to understand the flavor of our community, and that's what I think about this. Really, our patients become our community, and they really root for each other. They really do. Now, I might add, these young guys who are there, they are there just for overall well-being. And so when you ask me, do we do something for that, they're a good group to say, yes, we do. And why? Because they are high-level executives for a family-owned business that's very well known in Philly, and it's a hard business. They're traveling quite a bit, so they worry about exposures. These guys tend to come in once a week or every other week and sort of rotate between the executives. So we do have an executive group of folks who come in highly functional, who want to maintain their immune system to do exactly what you said, John.
Exactly. That's the point.
So I wanted to bring that up, but I also want to bring up what a wonderful community of patients we have, because they really do try to look out for each other. They'll give each other rides to the clinic. I mean, it's just a good group of folks.
Well, we've often talked about that, and this is not intended to be a kumbaya moment, but it's the truth is that everybody's friendly, everybody's nice, and
everybody tries to get. They all there for some kind of reason, and they're all health conscious.
Yeah.
And you know what? You learn a lot from each other, and I think that is a wonderful testament to how we've managed, and my staff too. As you know, someone asked me this week, is there really a lovely Linda? I said, here she is. So yeah. So the point is, we really try to maintain a community atmosphere. That's not to say we don't keep your problems confidential. Of course, we're a healthcare facility. We have to use HIPAA. But I have to tell you, people love to chat and talk a little bit about what's going on for them. And then they actually like to help other people.
And I will say, one of your patients not only made me jelly, homemade
jelly. Oh, I remember
jelly,
that, Barbara.
Wait a minute. She made me a special mustard. And Linda said to me, this is for you. You're the only one that got this. It is delicious.
There you go.
I mean, so it's like, I told her, keep it coming, you know?
Now, John, come on.
Okay. Frank is in the great Northeast. Frank, good morning. You're on Health Watch with Dr.
Hi,
Molly.
Frank. How are you?
Good morning, Dr. Molly and John. How you doing?
Hey, Frank. How you doing?
Frank. It's Frank R. How are you, Frank?
I have a competency me. Dumb allergies are killing me.
Your allergies are killing you, huh? Okay. Go ahead.
You said lovely, Linda. You're downplaying. Every lady there is lovely. They're all great.
Oh, you're right. You're right.
Dr. Molly, I'm taking the low dose naltrexone, the 1.25.
Right.
I've been on that same thing for a while now.
Right.
Should I keep it the same, adjust it?
I would say, why don't we adjust it back down a little bit? 0.2. Bring it down again. Okay? Bring it down 0.2. And so it'd be one. You'll be on one. The other thing, Frank, I want to tell you is, actually, I'm glad you called me, because I worked with Barbara this week on your case a little bit.
Too.
Oh, she is wonderful. That's my lovely Barbara, right? Okay. My competent Barbara, too. So we started talking. I'm thinking about putting you on the tinctures for your allergies, which I will get out to you this week. I think there's a particular product that my Italian company has that I'd like to talk to you about using in addition to the naltrexone. So, sit tight, and I will get it to you probably by Wednesday, okay?
Well, Dr. Molly, to refresh your memory, I've been there for, I guess, 3 weeks now.
Right.
Remember? Okay.
Yes, but that's okay. I'm saying I'm going to send it to you at home, right?
Okay.
I'll get it out to you. But I know you haven't been here in a while, but that doesn't mean you're not my patient, okay? We don't think of you that way. Just because you're not in taking the IVs, we like talking to you, Frank, okay? We want to help you. That's the bottom line.
And that first day was so wonderful. I mean, it was night and day, and I don't know what happened.
Well, you know what? Sometimes you've had these chronic conditions for quite a long time, as I recollect. So,
Yes.
it can take quite a long time to correct them as well. So
I tell you, Dr. Molly.
Yes.
You there?
Yes, I am.
I told you about the first day. It went down a little bit. Actually, it didn't go down. The rest of the body still stayed loose. It was just the neuropathy below the knee that never changed.
Mm-hmm.
I misunderstood that, because the tightness above that all went away and stayed away. It was just the tightness below the knee with the neuropathy that's aggravating me.
Well, maybe it's because we haven't done some more of the hydration. We'll have to talk about that, Frank.
Yeah, Frank, good idea to call Dr. Molly in the office.
I appreciate you calling the show, Frank.
Thanks a lot.
You're such a nice guy.
Thanks a lot for
God
the call.
bless you. Give my best to your mother.
And good luck.
God bless you.
Good luck with everything.
That's an interesting thing, because you notice he said the top part of the neuropathy had changed, but the lower extremities. Well, think about it. What do we have to do? We have to get the stuff down there, and it may take a little while to circulate. He has a multitude of problems. Trust me.
Yeah, so it will take some time. Right?
Absolutely,
okay.
absolutely.
Yeah, we got a couple of minutes before our next break, and we'll pick this up after the break if we have to. The men's health protocol has begun.
Yes, it has. I have 2 patients, and we're actually doing them on Tuesday. I have a full group in. I have a wonderful new male nurse who's coming in the evenings to help with this, should some guys feel a little, as you like to say, bashful. I like how you put that. A little bashful or feel uncomfortable, but having some of the female nurses with them. But I have to tell you, the registered nurses are tremendous. They get this, and they're used to doing this, as well as our male nurse, who's also a great guy. So the bottom line is we're starting with the acoustical wave length this week. But the reason why I'm mentioning it is he has taken 7 or 8 of our hydration therapies in particular. He has many challenges. And he has a challenge with his back. He had multiple surgeries on his back. So I'm thinking that he may have some additional nerve damage and things. So he's very intelligent. He read the material that I gave him, and he said, look, I know that I might have to be a lifer with these hydration, but we're really going to give this a good try, and I'm going to keep people abreast on what's going on with him.
You mentioned the acoustical wave. Could you explain that again?
It's acoustical wave. It means the wavelength actually goes on. You'll hear, look, you guys will hear about it every day on the radio and every day on TV. They talk about we can help your ED without any needles, without any this, that, and the other thing. Yes, it's an acoustical wave instrument. I have the Mercedes of the instrument, by the way, the best, because we can change wavelength, that kind of thing. And it can break up scar tissue, develop new blood vessels. But as I said before, John, the missing piece for me with all of the urologists who are doing this is if you don't improve blood flow, what's the difference? You need 40 cc's to sustain the erection. Well, in order to get 40 cc's pumped there, we better look at your cardiac health, your respiratory health, all of those things. And I know that our protocols can improve your blood flow. We know EDTA, for one thing, 12% head to toe. If you don't think that will help improve the acoustical wave and then help you have a better erection and possibly be able to sustain it longer, forget about it.
Yeah, I talked to a friend of mine who had the acoustical wave, not at your facility.
Oh, no, I know.
And he said, I can't sustain.
Right. That's
so
the big deal.
That's
a big deal for your partners, hon.
Right.
Listen, I spoke to a lot of women before I put this program in place. That's the joke. It was the women that gave me the impetus to put this in place, because they said, these guys are over there doing this, and although it's not needles, etc., it's a little daunting because you hear the noise. It's like being in the CT machine. You hear the noise. It's not painful, but you hear the noise. Guess what? What's the point of doing all that if we don't sustain and you're able to have a better quality of life with your partner?
Okay, we're coming up on our final break of the morning. We still have time to take 1 or 2 of your calls. So if you have a question for Dr. Molly or a particular medical challenge, this is a good time to jump in. 855-839-1210. 855-839-1210. That's the number here in the studio. Health Watch is the show, Sundays 8 till 9. Talk Radio 1210, WPHT, with Dr. Molly Fantasia, the PhD doctor, and the executive director, and the founder of Innovative Medical Associates. I'm your host, John DeMasi. We're coming back. More of today's Health Watch after these words. And we're back here on Health Watch, and operators are standing by, as per usual, at Innovative Medical Associates, and they'll be there well after we leave you at 9 o'clock this morning. So if you want to call after the show, feel free. But you can call right now, 856-489-0505, 856-489-0505, Innovative Medical Associates, Marlton, New Jersey. Remember, the initial consultation with Dr. Molly is complimentary. And all you have to do is call and book it. It's easy, 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A couple of minutes left of the show means you still have some time to jump in with a question or a comment at 855-839-1210. Here we're live on the radio with Dr. Molly, 855-839-1210. Always a variety of challenges in your office, Dr.
Absolutely.
Molly.
The traditional ones, the cancer supportive and those kinds of things. But, I really enjoy working with people who have autoimmune disorders because they come out in such twisted ways, John, pain, restlessness. I mean, there are so many things depending on the kind of condition. I have a big Lyme following, but this has been an interesting case. I have a young woman who came into me, and she is young, very intelligent. She came into me, and she has eczema and psoriasis she's gone to every dermatologist around. She's done a tremendously good job in terms of cleaning up her nutrition and that kind of issue. But, I mean, this is big. So she just started with me. And what we're doing is a combination protocol. Obviously, vitamin C has been known to help collagen, so vitamin C is part of the protocol. We also are using trace minerals because there's some relationship between minerals in this. But this is not a small case of eczema. This is a case that is all over her body. In fact, it's so bad that she said when she goes swimming, she actually puts on a wetsuit so people don't see it, so that she, doesn't have the stares and that kind of thing, from people. So we just started. We have helped her by using subclinical doses of a couple of meds, in particular a tincture. I'm using many of our homeopathics as well. And I'm using something for anti-itching that she's never had before, which was a very, very old medication.
All right, we'll pick that up.
Sure.
We have a call. Jim, was that Nina? Was that
Nina?
Snyder. Snyder in Chalfont, PA. Snyder,
okay.
Good morning. Welcome
Hi.
to the Health Watch. You're on with Dr. Molly.
Hi, sir. Hello.
Good morning, Doctor. How you doing this morning?
Good. How are you?
I'm glad you've taken the time to speak to everybody this morning. So I have a lot of information for you in a short time, but let me give you some information. Maybe you can steer me in the right direction. I was in an auto accident in October of 2019.
Right.
I've had 8 months of PT,
Ugh.
and I've had an X-ray, and I've had an MRI, and I've gone to Rothman Institute, and there's
Good.
no surgery, et cetera, et cetera.
Mm-hmm.
So what they're telling me is it's L5 and S1.
Mm-hmm.
Well, I was stopped, and I had somebody rear-end me between 45 and 50 miles an hour.
Mm.
But I was leaning over towards the passenger seat when I was hit.
Ugh.
So there's nothing anybody can do for me, and they keep telling me that. I have excruciating pain when I'm bending. I
Ugh.
had one endural injection.
Mm-hmm.
That seemed to help a little bit, and I was comfortable with that. They told me to have a second one. After the second one, I had pain. It turned around, and it wasn't beneficial.
Okay.
So now they want to do a third injection in a different area. I'm not satisfied with that.
Okay.
So I'm
Go ahead, sir.
trying to reach out to maybe go to Pennsylvania Institute in Philadelphia. I
Sure.
don't know which direction to go in.
Well, listen, it sounds like this is a terrible situation, and believe me, I understand pain. It could be that they need to do the series of these shots before they can go in possibly and do a nerve block. Did they talk about any of that, where they can actually block the nerve? Go ahead.
And then you correct me, when a nerve block, because I've talked to other people that have nerve block,
Sure.
maybe 8 months to 12 months, they have to do it again and again.
It can happen because you know what happens, don't you? The nerves start to grow back, and they actually get back. Now I'll tell you something that's interesting. I have 2 patients right now who've had the nerve block where I sent them, and they come back to me, and we treat them with the hydration protocol that actually has maintained their nerve block for well over 24 months. So I can only tell you that we can help in this regard. The other thing I would tell you we would do, is we might look at this from the homeopathic point of view. And in addition to the nutritional IV, we might do some homeopathic IV, which we have done. I understand how hard this is, and I know, but the standard of care is, and this I'm saying from the traditional point of view, you can't fault the orthopods and the pain people from these big institutions, of which you went to one of the most well-known. You can't do it because they have to work within the parameters of what the insurance company tells them they have to do. Otherwise, they don't get paid. I would tell you to explore something like I do. In addition, definitely. And I'd love to see you, and I would love to see your radiology too.
Yeah, Snyder. What I can tell you right now, because we're rapidly running out of time here on the show. If you call Dr. Molly, she can have a discussion in the office, and there's no time constraint. So you can just do
and
that,
I would
okay?
really like to send you for that nerve block to someone I know. So, but I can't say that on the radio.
Which, by the way,
No, I get
I'm
it.
getting done. I'm getting that done next week, Snyder. So Dr. Molly knows about this.
And it's really something that may help you. And then follow up with me. I think you'll feel like a new guy. Okay.
All right, Snyder.
Thank you. God bless you.
Thanks a lot for the call.
That was a great
Appreciate it.
call.
Yeah. Well, interesting that he brought that up.
Yes.
I'm scheduled to go to the doctor that you sent me this week.
And what
for
I'm
the same kind of thing.
But you heard me tell you before we started. Listen, don't be upset. He may not be able to do this until you're. And you know, some of the best guys in the world who are pain guys are anesthesiologists. So
Right. But
just a side note for him to know they're not necessarily bone doctors.
Yes.
Right?
But you also mentioned it to Snyder, and you told me before the show that they have to do certain things in
That's
order
right.
to get paid.
In order to get paid. So
they have to kind of go through the stuff that they know is not going to work.
they
in order
already,
to, right.
yeah. But I'll tell you, I could keep him relatively out of pain till he even gets to that if he started with us.
And guess what? That's the signal.
I know. And you know, I help you stay out of pain over this.
Yes, I know. Yes, okay. Yeah, I know you have. That's going to put the wraps on another edition of Health Watch. Don't forget, if you want to talk to Dr. Molly during the week or you want to make an appointment, you can do that right now at 856-489-0505, 856-489-0505. Also, check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com. For Dr. Molly, Fantasia, and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, Joanne, and our nurses Jess and Crystal, and our medical assistant Kathy, I'm your host John DeMasi. Thanks for listening. Have yourself a great week and a healthy one. We'll do it all over again. We'll talk to you next Sunday, Health Watch 8 till 9, here on Talk Radio 1210 WPHT. You take care.